Thank you so much, moderator, and thank you for giving us the opportunity to be with you today to take you through the partnership for accelerated COVID-19 testing, the initiative launched by Africa CDC and African Union to push this agenda forward to have widespread for testing for COVID-19. Let me take you quickly through the initiative and the importance of having such initiative under African Union leadership. So PACT is acronym for Partnership for Accelerated COVID-19 Testing. And the goal under this initiative, we have 5 main goals. The first one is to conduct 1 million tests for COVID-19 within a month and to reach to 10 million tests within the coming 4 months. And also to establish Africa-wide pooled procurement mechanism that will enable member states to start procuring infection prevention control supplies, lab tests, and lab supplies as well. As you may know that worldwide we are facing difficulties for availability of these infection prevention control supplies like masks, gowns, and gloves, and also the test as well, the availability of the test. We have this pandemics, it's all over the places, all over the worldwide. So we are facing increase in demand and the supplies is limited. So we're trying through Africa CDC to have this pooled procurement mechanism that will enable member states to have this kind of test available for member states and also infection prevention control supplies. Second part, to establish wide storage and distribution hub. What we have done so far as Africa CDC in collaboration with the Jack Ma Foundation. Jack Ma for the last 1 month gave donation for Africa CDC in collaboration with initiative from Prime Minister of Ethiopia, and Africa CDC managed in collaboration with World Food Program to distribute this donation for all 55 member states within 5 to 6 days. So we're trying to use this kind of platform in collaboration with World Food Program. Also, we're working with Peace and Security to have this mechanism in place. Once we have this kind of supplies related to infection prevention control and also related to lab supplies, we are able to distribute to all member states within a short duration of time. The fourth goal is focus on community health care workers. And we are targeting to have 1 million community health care workers to use them in contact tracing. The last one is to deploy and use standardized new technologies for surveillance that will enable us to reopen the economy again. What is the importance of this PACT initiative and to have wide scaling for testing? The importance of testing, when you start doing testing and wide scaling of testing, you identify and classify the communities into 3 parts. The first one, you identify the cases, this group of the cases. Then you start isolating them, treating them. The second group, identify the contexts for these cases. Then you can be able to start tracing them, do follow-up for those contexts. And once they start developing any symptom, you will be able to quickly start testing them and also to isolate them if they become cases. And the third group is the healthy people. The healthy people, you continue advocating for health and safety measures that they need to follow in order to protect themselves. So when you start doing testing, you classify the community into those 3 groups, then you start doing the intervention according to each group. So you have identify and isolate the cases. Second, robust contact tracing. And the third, you identify the area for concentration of the cases. And once you identify this area where the cases are concentrated, you can start doing targeted measure. As we can see that most of the countries suffering from the economy because they start implementing measures such lockdown measures, maybe at the national level. But when you start widespread testing, you can target your intervention. So you can focus on certain area. Instead of implementing national lockdown, you can implement targeted partial lockdown on certain area where we have a concentration of cases. Then when you have widespread for testing, you can have better insight about the spread of disease in your communities. And we have some lesson learned from other countries, similar to South Korea. South Korea, early at the beginning of the outbreak, they start doing this wide testing. Even they make what is called drive-through testing. You take your car, go to a certain station, they take sample. Within 6 hours, they inform you about the result of your sample. If you become positive case, then you go for isolation. If not, you continue your life. With this kind of massive testing, they didn't have to go through lockdown measures or curfew, night curfew measures, because you will be able to identify the cases at wide scale, identify contacts, and identify the healthy people. The same for Iceland. Early at the beginning of the outbreak, they tested more than 10% of their people, and only they have out of 1,770 cases they discovered, they have only limited number of deaths, 9 deaths reported in Iceland. On the other side, if we look at Japan, one of the countries initially at the beginning of the outbreak, they have lowest number of tests per capita. And after they start easing their measures, they start finding more than 130 cases with unknown link. And this is a dangerous sign for us. In public health, would like, when we discover cases, to link these cases to what is the source of infection. Either this case is infected from another case who we know exactly the chain of transmission. This case X is infected because it's linked to case Y. Or also this case X is coming from affected area. So this is most probably the source of the infection coming from affected countries or affected area where we have wide transmission for the disease. But when you start discovering cases and you are not able to connect these cases to another confirmed cases or coming from affected area where we have widespread for transmission, this is now give you a sign that this disease starts spreading in the communities and it may go beyond the control. The same experience in United States, they start slowly in rolling out testing, and now we can see that United States become the epicenter for this outbreak. So what we are targeting at Africa CDC for the testing component of PACT Initiative, this PACT Initiative include of testing, track and trace, and treat. This is the 4T that included under PACT Initiative. The first component of testing, we will be working as Africa CDC with member states to ensure uninterrupted supply chain for COVID-19 test, not only the test, not only the reagent, but also the necessary supplies that needed to ensure that the country are able to do testing. Early at the beginning of the outbreak, we start providing reagent for the country, but additional supplies that they need to start doing testing, also country start facing difficulties in having this test supplies. So what we are working now, when we start providing these tests to the countries, we provide reagent and also additional test supplies that needed to conduct these kind of lab tests. The second one, we are asking member state to start doing decentralization for testing. Early in the outbreak, most of the countries doing centralization of testing. They have their own laboratory at central public health laboratory, maybe 1 or 2 in country, and they collect the sample from all over the country and do testing only in 1 or 2 on 2 labs. To do wide scale up and wide spreading for testing, we need to do decentralization, to have more laboratories available in the countries. We can use subnational laboratories, veterinary, private laboratories, research, university laboratories, and enable them to do testing so we can ensure wide scale for the testing. Also, to use automated laboratory function. The old method to use manual methods, and this is take long time, and also the number of tests that you can perform within a single day is very few. But with automated RNA extraction with automated machine, and also unlocking some of the devices in collaboration with the companies to do testing with using reagent and test kits from other companies. This will enable the country to do wide scale for the testing. Also, another technical method to use what is called pooling testing. This is methods that will enable the country also to increase the number of tests that they can perform per day. Workforce readiness. In order to scale up this number of testing, we need also trained workforce development in the laboratories that will be able to do this testing. Since the beginning of this outbreak, early in February, in Africa, we had only 2 countries able to do testing. It was South Africa and Senegal. With support from Africa CDC, we managed to train within 3 weeks, 43 countries. And now we have 48 countries, they have the capacity to do testing. And what we are trying to do now to scale up this number of people that trained previously by Africa CDC to conduct cascade training in their countries. So have more workforce trained to do this kind of testing at the national level. Reinforcing also specimen transport through establishing and strengthening report and dedicated specimen transport measures, and also ensure efficient and uninterrupted workflow for this testing within the laboratories. And the last one is rapid diagnostic, and we need to be careful during this time for using rapid diagnostics. We have many rapid diagnostics, antibody-based rapid test and antigen-based rapid test. However, minimal studies have been done about these rapid diagnostics. So when the countries start adopting these rapid diagnostic, they need to conduct further researches about sensitivity and the specificity of this rapid test. What we have done so far and what we are planning to do to increase this testing, we distributed initially at the beginning of the outbreak more than 80,000 tests, and we increased this number in the last 1 month to reach more than 300,000 tests. And with collaboration with Jack Ma Foundation, we managed to distribute 1.1 additional million tests to the countries. And we are targeting within a month to distribute 1 million tests. We already received 500,000 from Jack Ma Foundation, and we put an order for Germany to purchase 500,000 tests. We start receiving some of these and we start distributing to member states. For capacity building, as I mentioned, 42 member states, they have the PCR diagnostics with support from Africa CDC, and we increased this number recently to reach to 48 member states. And we are looking also for new diagnostics for the countries that they don't have PCR capacities. So with this new diagnostic, they will be able to do this kind of test soon. Also, we developed the standard operating procedures for testing, for interpretation and test of test results, and the specimen collection, and make it available to member states. We start deployment also laboratory experts, and we are planning to deploy more experts in lab and rapid responder to support member state in training and providing technical support as well. And we are planning to conduct virtual training sessions for laboratory technician to improve their practicing and to improve the country capacity. As I mentioned previously, we are trying to engage private sectors at the country level. So with engagement from private sector, we can expand our capacity for lab testing. In addition to the first T, testing, we are going for track and trace. Track and trace, we need to track the spread of the outbreak within the continent and within the country level, and to be able to trace the contacts. When we start identifying the cases, we need to start identifying who are the contact of these cases. Then we do follow up for the contact of these cases for 14 days. So once any one of the contact start developing symptom, we rapidly start doing testing for him, start isolating him if he become a case. Our target is to work with different partners to have 1 million community worker that will enable having the initiative for contact tracing, and also working with different companies to have technology that will facilitate the work for tracing the contacts, and also to have surveillance data system at member states and emergency operation center that will facilitate deployment of experts and managing the information and resources to ensure better and efficient response to COVID-19 pandemic. Under track and trace, so we are looking for what is called smart screening. We encouraging member state. One of the frequently asked questions coming for us at Africa CDC, some of the countries increase the number of testing, however, the number of cases that they are discovering is low. So we encourage them to use what is called smart screening. So member states to focus attention on population where COVID-19 is more likely to be circulating. So once you discover COVID-19 cases in certain areas, so you suspect that this area may have number of cases, then you start investigating this area, doing screening in this area. We have experience here also in Ethiopia. They start going from door to door screening, start asking the people in the houses about the symptoms of COVID-19. And once they suspect cases, they start doing testing for these cases. The second methods for also to ensure smart screening and active case searching and detecting for the cases early, to do active case investigation. Once we pick cases, the team epidemiologists go to do what is called case investigation. They start asking the case about the contact that has been exposed with him in the last 48 hours, the close contacts. And also it is recommended in the area where we find the cases to start looking in the houses nearby from these cases, looking forward to get active cases. Maybe there is another cases in the community and we didn't discover them yet. So it's recommended to check in the houses around where the cases live, and also in the workplace where this case work to detect more cases. Trace all contact. This is a key to control this outbreak. We need to identify all the possible contacts, especially the close contacts, and identifying them, listing them, have a daily follow-up with them to measure their temperature, ask about the symptoms for COVID-19, and once they start having the symptom, we start taking them to health facilities, doing testing for them to identify if they are cases or not. The same, activating local detection points. One, a use of traditional healers, different laboratories, pharmacies, drug dispensing shops, and spreading the message about COVID-19. So once any population go for these traditional healers, drug dispensing shops, laboratories, they need to start asking them about the symptoms for COVID-19. If they have any suspected cases, they need to direct them to healthcare facilities dedicated in the countries to deal with the COVID-19 cases. Also, we're recommending for member states to do immediate triage at healthcare facilities. All healthcare providers, either public, private healthcare facilities, it's important to do what is called triage. Any patient coming to any healthcare facilities, you have a dedicated person at the entry point for these healthcare facilities to check his temperature, to ask about symptoms for COVID-19. Once suspect any COVID-19 cases, so they direct them directly to isolation room, then healthcare professional come and do further investigations. And the last one for track and trace is engaging the communities. We need to spread the message about COVID-19. What are the symptoms of COVID-19? How to protect yourself from having COVID-19? And if you start developing any symptoms, what should you do to protect yourself and protect your families? What is the nearest healthcare facilities? And we believe that role of youth in spreading the message about COVID-19 symptoms and way to protect yourself, and the national protocol, how we deal with the suspected cases. I think the youth had very important role, especially for spreading the message and have more engagement in the communities. The last T in the PACT initiative, as we mentioned, PACT initiative, we have 4 T. Test, we have trace and track, and the last T is treat. For treatment, this is different from country to another. We have different experience. For home-based care, some of the countries, for mild cases with no risk factors, they don't have chronic disease, they don't have problem with the immunities, so they may ask mild cases to stay at home and have also to be taken care by one of the family members. The same strategy is implemented in United States and most of European countries for mild case. However, we have different experience in China. Even for mild cases, they dedicated certain facilities, not his hospital. It's big spaces like stadiums where mild cases can stay at these facilities. So countries may choose one of these options, but when you start choosing the option for home-based care, you need to take care of certain points in consideration. The first one, careful clinical judgment and assessment to verify the residential settings, the house where this case stay. Can we provide the proper clinical care in this house? Do we have a dedicated room for this person where he can stay, so we can avoid spreading the disease from this case that will stay in home isolation to other household members? Do we have a specific toilet where this guy can use, so we can prevent further spreads? It is easy for the people staying with him to implement infection prevention and control measure to prevent further spread within the house itself, and also to raise the awareness of the people that live with the case in the same house, how to protect themselves while they are taking care of this person that the case that is staying with them in home. So this is the first one for home-based care. For the second option, facility-based care, and our recommendation for once early identification for patients with severe illness, and also maybe the mild cases, mild or moderate cases. However, they have other comorbidities like hypertension, diabetes, and other risk factors. Our advice for those to be isolated in dedicated healthcare facilities where we have infection prevention control measures in place, where we have good treatment and care available for them. In general, also attention should be paid for chronic therapies and monitor drug-drug interaction while we are taking care of those patients. And also what we'd like to say at the end for this lecture, so far there is no current evidence and recommendation for a specific treatment against COVID-19 that impact the consequences of COVID-19. Yes, there is a recent drug in United States under emergency authorization, and we have noticed that this emergency drug is minimize the number of days. Instead of the patient take around 15 days under treatment, the number of days is less, it become around 11 days under treatment. However, no impact on the consequence of disease. There is no impact on the death and case fatality rate out of this disease. Other drugs are like hydroxychloroquine. There is no indication about the safety of using these drugs for treatment of COVID-19 cases. So in summary, PACT initiative, we have 40. The first one is test. Second one, track and trace all possible contexts. And the third pillar is focus on treatment. Over to you if you have any questions. Thank you.